Welcome to Natividad. I'm Melissa Nothnagel. I'm the Residency Director and the Chief of Family Medicine. Natividad is the county hospital for Monterey, serving the city of Salinas and the rural communities of the Salinas Valley. Natividad is also California's first public hospital. We continue today to uphold that legacy of service to the most vulnerable. If you are committed to caring for underserved communities, seeking excellent full-spectrum family medicine training, and want to live and work in a really beautiful place, we hope you'll join us at Natividad. We recruit amazing, mission-driven residents who are passionate about serving and advocating for our patients. Many of them are immigrants or first-generation Americans themselves, and many grew up in communities that are underserved like ours. Natividad is a single residency hospital, meaning family medicine residents are the only residents in the hospital. Our faculty across all specialties are proud of their role in training full-spectrum family physicians, and they make sure that our residents have a high level of responsibility across all their clinical experiences. Our Continuity Clinic is a federally qualified health center that's located right on the hospital campus. Residents work one-on-one with their medical assistants, all of whom are bilingual, and we provide comprehensive services for our patients that include office procedures, point-of-care ultrasound, social work, high-risk prenatal care, medication-assisted treatment for opioid use disorder, and on-site legal advocacy services.
As a designated public hospital or safety net institution, we care for everyone and anyone in the county that needs medical care. However, our predominant patient population includes the underserved population, primarily those who are working in the agricultural industry. Natividad, we've just undergone a tremendous amount of change over the last decade. We're currently completing a total remodel of our diagnostic imaging department. So we're going to have a new 3 Tesla MRI and 2 CT scans, as well as a new interventional radiology lab. All these services augment our patient care across the board, but they specifically augment our trauma program. In 2015, Natividad was designated as the Level 2 Trauma Center for Monterey County. We are the only trauma center between Santa Barbara and San Jose.
Natividad's residency is special because you become a part of our Natividad family.
What's great about taking care of the patients at Natividad is how grateful they are for the service that we provide them, even though we feel honored to be here and taking care of them. We're able to model the full spectrum of family medicine with our family docs doing inpatient medicine, doing OB, and also doing outpatient medicine. Here at Natividad, our residents are placed in teams to provide better support for the patients and support for each other. We have 3 inpatient medicine teams, the family practice team, the Medicine 1, and the Medicine 2 team. The family medicine team has 3 members. It's the first year, second year, and third year. And the Medicine 1 team, which the residents are also on, has 2 first years and a second year. First year residents are always teamed with the senior resident early in the year to help them learn the systems and better take care of patients. And as they build confidence, they assume more responsibilities. Both teams work integrally with the case management and social workers to help learn the needs of the patients.
Here in Natividad, our labor and delivery unit is a team, a family, which incorporates the doctors, the nurses, the residents, and our NICU team.
Natividad has received a few national recognitions. Most recently, we were ranked in Newsweek as being one of the top maternity care hospitals in the country.
What impressed me most about the family practice residents here is that they really have a quick and thorough handle of obstetrics. I was impressed immediately on nights when the second years come, and the evolution of seeing someone as an intern just really grow. It's really a multidisciplinary approach. Our family practice docs work with our OBGYNs in conjunction with anesthesia, who's on call 24/7. Our labor and delivery nurses, who are amazing, will really be also your teachers here at Natividad. The pediatricians, the NICU team, all collaboratives in working with you to have this really well-rounded experience that we have a lot of pride in, and we really value to provide this great care for this wonderful community.
Something very special about the pediatric care here at Natividad is the fact that we have 24/7 pediatric hospitalists, which allow us to help with care with children in the ER, inpatient, newborn nursery, and at the same time be available for the residents at any time during the day or night.
The residency is really part of the fabric of the institution. It's hard to imagine Natividad without the family medicine residency. just a tremendous legacy of education, and specifically in family medicine and primary care here.
It's the mission of the place that's the glue that keeps us together, that keeps us focused, that keeps us moving forward, and again, keeps me going home, never questioning whether what I did had value. It always has value.
Physicians and non-physicians work together as a team and really feel a sense of mission to the patients and the community.
The ideal resident is someone who's mission-driven just like we are, dedicated to serving our population, and those are the patients that we really are proud to take care of, and it's the patients that we want our residents to also take care of.
Someone who is a good listener and has compassion for their patients and what their complaints are.
In my experience, what makes a good family resident is a person that is ready to help, assist, educate the underserved community that we offer here in Natividad.
I think what makes a good family medicine resident is someone who has the will and the heart to support our patients. If you are a Spanish speaker, that's a +1. Someone that is able to cooperate, that is able to be patient, humble, and more than anything, that you love your job and that you're willing to go far and beyond for your patients. This is a spot for you.
Someone who's looking for very broad-based training that includes procedural skills, OB, ICU care. I think we're unique in the fact that we can offer such a huge breadth of training to our residents. You know, folks who are committed to our mission tend to be those who get the most out of serving their residents here at Natividad. So if you're interested in the underserved, you're interested in social justice, you're interested in healthcare equity issues, Natividad is a great place to train.
I came to Natividad for the full spectrum training for the single residency hospital that we have here. It really empowers us as residents to kind of take ownership of our service, of our patients, no matter where we are in our training, in the hospital, in the clinic. It's a really wonderful hospital. It's mission driven. They really, as a hospital and as a residency, people really care about their patients, about their community, about serving the underserved and reaching the farm worker population that's in the area. So it's a really inspiring place to get to be part of the Natividad family.
What drew me to this area is the patient population that we serve. And being somebody that's bilingual and bicultural, I really found that this community here resonated with me. A lot of the patients that we treat and see are very similar to my own family members, which makes it a special connection when I'm taking care of patients here. And at Natividad, we do serve a lot of underserved populations, low-income immigrant populations, farm workers especially, and I'm very proud to be part of this team to help take care of them.
My inspiration definitely is just working side by side with my patients, my community. I come from a Spanish-speaking background, and I understand the struggle to just get appropriate education or get information as of taking care of your health. The reason why I'm here is because I want to provide that. I want to provide help. I want to provide education and offer high-quality care to our patient population.
Natividad is settled in Salinas Valley, which embraces many cultures, populations from different backgrounds, different parts of the country, other countries. And it's a great learning opportunity. We are a team. We work together as a team, and we want to teach you together as a team.
Salinas is a working person's town. Monterey County is a working person's place. We don't do fancy. I think we do real. I think we do real work. Our clinic, we are the community. If you go out and you talk to people, where do you go for care? They'll say the Laurel Clinic, they'll say Natividad Medical Center. They identify with us. We're their home.
Natividad is a cause. At the beginning of residency, they talked about how our patients are grateful, and that sounded great, and it's even more true to me now, and that's probably the thing that feels the best about working at Natividad is I feel like everybody's, I take care of my patients, and they're saying, I pray for you every day. They're telling me, thank God you're here, and I'm not a religious person, but I can't get enough of that.
Most of our patients are farm workers who are very vulnerable for so many reasons. food insecurity, employment insecurity, immigration issues, living in crowded housing. So we really have a lot of opportunities to advocate for them, not just in the realm of healthcare, but out in the community to improve their circumstances and assist them in being able to have a healthy life.
Yeah, Natividad as a county hospital has a wide spectrum of services, and they're really, what I'm impressed with is how well they're integrated together, and they also are really high quality and they really look nice too. It's, when I trained, the county hospital was always sort of the decrepit hospital. It's really a really wonderful institution where things work well and work well together for multidisciplinary care that we know causes better patient outcomes.
Our graduates are well prepared to practice hospital medicine when they graduate. And many applicants also seek us out for our high volume and high risk maternity care experience. And we also have a very comprehensive family planning curriculum that includes opt-out abortion care. We're very proud of our longitudinal community medicine curriculum. It spans the 3 years of residency and prepares residents to address the social determinants of health that affect their patients.
So Natividad is a county safety net institution. We're licensed for 172 beds. We actually trace our history back over 130 years. So there's been a hospital in Salinas near this location for well over a century.
So as a teaching and learning community, our residency program is really special in terms of the types of people who are here to teach us, our attendings, even between the core faculty, family medicine folks, in addition to the cardiology attendings or the nephrology attendings, everybody really is here to teach, and they really like to support our residents and our residents' learning, even if they're not official core faculty.
I did OB here for nearly 20 years. I stopped a few years ago. I still do hospital stuff. I see my own patients every week. I was there yesterday. I precept in the clinic. I attend on the inpatient service in the hospital. I'm the hospital's ethics dude, and that's kind of my thing academically. You can even look me up.
Teaching is central to Natividad's identity and culture. We are part of the UCSF Educational Alliance, and residents teach medical students on all of their major core clinical rotations. Our graduates are prepared to practice in any setting. You'll find them practicing outpatient family medicine, maternity care, hospital medicine, rural health, and global health care. And we have over 60 graduates practicing in Monterey County, from rural clinics and hospitals to urban community health centers.
One of the reasons why I decided on Natividad is that we're a single residency hospital, and we get a full spectrum of training in family medicine. And it really does encompass everything from the start of a pregnancy, birth, pediatrics, infancy, all the way up to adolescence and geriatrics. So we really get that special training at this place, and we're able to get a high quality of one-on-one teaching in every one of those areas.
Natividad Family Medicine Residency attracts a lot of applicants, and there's a good reason why. The collaborative, well-rounded, community-based program really will prepare people, whether they're going to be in an urban or rural setting. That includes our obstetrical care, which is especially important if you do want to provide full-spectrum services to your patients. I think that the hands-on experience, you have attendings with you, but you also have the autonomy to really grow and become your own physician, and I really appreciate that. You want to be hands-on and get the experience, get in the OR, get your suture thrown, and here it's an unimposed program. I feel like you're going to get all the experience you need in all the different subspecialties.
You know, our family medicine program has been around since approximately 1975. I think it's always been just a phenomenally strong program, and I think we're really fortunate that we have dedicated faculty who have been given the tools to do their job and to teach. I think there's just a really robust, strong commitment to education and supporting our residents' well-being and education.
The cohort that I went through in residency are some of my closest friends. We've gotten to celebrate milestones beyond residency together. We still keep in contact for those side consults that we need. And this is just a great place where you will develop friendships for a lifetime.
Everyone knows each other pretty much. We are just a huge big family here. Most of us work 12-hour shifts, so we really get to know each other pretty well, and we work really well together. But you have your full spectrum of skills that you'll be able to use in all our different departments and with our acuities.
I think the Laurel Family Practice Clinic, where you will get to work, is a very special place where you finally, as a doctor, can learn to take care of patients in a continuum. It was the first place where I got to take care of patients over the next 3 years, which I got to develop some really amazing relationships. I got to deliver babies, take care of those babies, take care of grandma of baby and grandpa, and also take care of brothers and sisters. And by the end of my 3 years, I had family units that I got to take care of, which was just an amazing experience, I think, that you don't get anywhere else. I know it can be hard as residents, going to different rotations and things, but clinic, I really learned to love that. And that's actually what made me choose to continue to be a full-time clinician in outpatient, is because I just love that idea of being a primary care physician for people to have a home base amongst everything else that's happening in their lives, get to know them as people and serve them and take care of their healthcare needs.
One of the things that I enjoy the most with working with our residents here at the Laurel Family Practice Clinic is that they are able to understand our patient's situation. We are a county clinic, therefore a lot of our patients don't have insurance. I believe that the fact that doctors are, kind, and they go out of their way in a lot of situations to help these specific population patients is something really.
I decided to stay at Natividad because of this community that surrounds this area. This is a place where so much produce is grown, there's so many agricultural workers, and I wanted to serve that population. My mother was an agricultural worker when she came to the United States from Mexico. And I knew that I wanted to give back to this type of community. And that's why I decided that being at Natividad, not only was I going to be able to serve the agricultural population, but I was going to be able to help a lot of immigrant population as well. This is a beautiful area, I believe, not only to practice medicine, but also just to live. And I like not being in a big city, and so I felt that returning to Natividad was the place for me.
All I can say is welcome to Natividad. You will love it here. You will love the faculty and the training you will receive, and you'll love Salinas.
Look at some shots of the Salinas Valley, the ag. When you go to the market and buy a bag of lettuce, I guarantee you flip it around, it's probably going to say Salinas on the back. When you go buy a basket of strawberries, it probably says Watsonville or Salinas, which is, up the road.
One of the things I enjoy most is meeting all you new residents. It's been an honor for me to be part of this program, learn from the faculty here, and I know you as a new resident will be awesomely trained. That is one thing we are just so proud of here at Natividad. We turn out excellent physicians who are just so capable once they get out into the real world.
If you're looking for a place where you're going to be broadly trained from OB, rural medicine, internal medicine, I think as far as broad spectrum family medicine goes, Natividad is the perfect place for you. Having recently graduated from Natividad Family Medicine Residency, I can attest that this place has made me the doctor that I've wanted to become. This is a place where not only was I nurtured by the faculty members, by the staff that was able to train me into the doctor that I've become, this was a place where I truly grew. Here at Natividad, our motto is inspiring healthy lives, and we hope to inspire you through this video to consider Natividad Family Residency as a place for you to train. We look forward to meeting with you.
I think there's a lot of reasons to come to Natividad. Number one, I think is great training. Number two is great people. I think number 3 is really great patients. I think sometimes the best way for me to answer the question is, you know, why have I been here for 20 years? And I have to tell you, a hospital is a hospital, but it's really the people that work in the hospitals, the patients that you care for, that's what makes the hospital special. My experience here has been I've had phenomenal colleagues, phenomenal support, great mentors, and really the warmest, sweetest patients that I've ever worked with in my entire career.
Thank you so much for your interest in Natividad. We hope that we've shown you what a wonderful place this is to live and work, and that you'll want to come be part of our Natividad family.